Hi friends, good evening. Once again, welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. Also, these questions will helpful for your other nursing officer exam. Today, we can see important questions and answers. First question, the mother of an infant with a cleft lip asks when the repair will be scheduled. What is the nurse's best response? Options: Option A at birth, Option B during the first 6 months of life, Option C after 6 months of age, Option D at 1 year of age. Here the question is, an infant is having the problem of cleft lip. So the mother of the infant asked the nurse that when they can do this cleft lip operation. So among this option, which one is the best response by the nurse? That is our question. So we have to select the best response. And our correct answer will come during the first 6 months of life. Option B is the correct answer. This cleft lip and cleft palate are congenital anomalies that occurs as a result of failure of the soft tissue or bony structure to fuse during the embryonic development. So they are the congenital anomalies. Closure of cleft lip is performed by the age of 3 to 6 months. So that is our question answer. During the first 6 months of life, between 3 to 6 months, they can schedule the repair. And the closure of cleft palate means it is performed between the age of 6 to 24 months, usually between like 18 months of age, like that. Okay, between 6 to 24 months of age. Move on to the next question. On the second postoperative day after repair of cleft palate, what should the nurse use to feed a toddler? Options: Option A cup, Option B a straw, Option C rubber stripped syringes, Option D large holed nipple. Here the question is, on the second postoperative day after cleft palate repair, what should the nurse use to feed the child? That is our question. Which one is the best thing to feed the child? And the correct answer is, can use a cup. Option A is the correct answer. Cleft palate repair is performed between 6 to 24 months of age, usually at the age of 18 months. Okay. By this age, child can able to drink with the help of a cup. So, it will not be irritate the suture gland. Also reduces the risk of injury to suture in the palate. So, better to use with a cup. Move on to the next question. A patient is admitted with a suspected bladder cancer. A nurse assesses the patient for which of the following earliest manifestation of the disease? Options: Option A proteinuria and dysuria, Option B hematuria and no pain, Option C painful urination and hematuria, Option D pyuria and palpable abdominal mass. Here the question is, a patient is admitted with suspected bladder cancer, and which is the earliest manifestation of this bladder cancer? That is the question. And the correct answer is option B, hematuria and no pain. Visible painless hematuria is the most common symptom of bladder cancer. So here hematuria with no pain, painless hematuria, that is no pain, is the common symptom of bladder cancer. And also patient may have frequency, that is frequency of urination, then urgency, dysuria, all may experience by the patient. Here the correct answer is option B. Move on to the next question. A nurse is writing a care plan for a client newly diagnosed with cancer of larynx. Which problem would have the highest priority? Options: Option A wound infection, Option B hemorrhage, Option C respiratory distress, Option D knowledge deficit. Here the question is, a nurse is writing a care plan for a cancer of larynx patient. So which problem is the highest priority while writing the care plan? That is the question. Correct answer is option C, a respiratory distress. Laryngeal cancer is the malignant tumor of the larynx, and the patient may have dyspnea, persistent hoarseness, sore throat, painless neck mass, feeling of a lump in the throat, then burning sensation of the throat, changes in the voice quality, weakness, hemoptysis, or the manifestations of this laryngeal cancer. So while writing care plan, nurses has to focus on the respiratory status of the patient. So first we have to assess the airway of the patient. So that is the correct answer, option A, respiratory distress. Move on to the next question. Which of these patient dietary habits does the nurse understand may increase the risk for development of colon cancer? Options are option A, high fat, low fiber intake. Option B, high intake of milk and milk products. Option C, low meat and protein intake. Option D, low fat, high carbohydrate intake. Our question is, which one is the risk factor for the development of colon cancer? In short, that is our question. So our correct answer is high fat, low fiber intake. Option A is the correct answer. People who consume high fat and low fiber intake, especially meat and meat products and all, may cause the development of colon cancer. That is one of the risk factors. In this flowchart, we can see the risk factors of colorectal cancer. First one is increasing age. Second is family history of colon cancer or polyp. And third one is previous colon cancer or adenomatous polyp. And next one is history of inflammatory bowel diseases. And next one is high fat, high protein, low fiber diet. High fat and high fiber, especially with high intake of beef and all, and low fiber diet may cause development of colorectal cancer. And genital cancer or breast cancer in women also, there is a risk for the development of colorectal cancer. Move on to the next question. Which of the following lifestyle factors is most closely related to bladder cancer? Options: option A, sedentary lifestyle. Option B, drinking 2 bottles of cola daily. Option C, smoking 2 packets of cigarette daily. Option D, living in an industrial area. Here the question is, which lifestyle factors can cause bladder cancer? And the correct answer is among this option, option C is the correct answer, smoking 2 packets of cigarette daily. Here we can see the risk factors of bladder cancer. First one is cigarette smoking. Cigarette smoking risk proportional to number of packs smoked daily and number of years of smoking. So that is our question answer. Okay. Taking 2 packets of cigarette daily. And the next risk factor, environmental carcinogens like dye, rubber, leather, ink or paint. And next factor is recurrent or chronic bacterial infection of the urinary tract. And bladder stone, then high urinary pH, high cholesterol intake, pelvic radiation therapy, cancers arising from the prostate, colon and rectum in males are the risk factors of bladder cancer. And the next question is, most common site for carcinoid tumor is? Options: option A, duodenum, option B, jejunum, option C, ileum, option D, appendix. Our question is, which is the most common site for carcinoid tumor? So what is carcinoid tumor and where it is originating, that we can see. These carcinoid tumors are arising from the neuroendocrine cells in the intestinal tract. Okay, so these are the some neuroendocrine cells which is originating in the intestinal tract. Also it is seen in bile duct, pancreas and ovary. And the most common site of this carcinoid tumor is in small intestine, especially in ileum. Okay, so our correct answer will come option C, ileum. And also it is seen in rectum, colon and appendix, the other common site. Okay, so here the answer will come option C, ileum. And the next question, which finding would indicate that an infant with tracheoesophageal fistula most needs suctioning? Our options are barking cough, option B, substernal retractions, option C, decreased activity level, option D, increased respiratory rate. The question is, the diagnosis of the infant is tracheoesophageal fistula, and which findings indicate the infant need suctioning, most need suctioning, that is the question. And the correct answer is option B, substernal retraction. In tracheoesophageal fistula, overflow of secretion to the larynx lead to laryngospasm, and there is obstruction to inspiration. Stimulate the strong contraction of accessory muscles of the larynx to assist the diaphragm in breathing. This produces substernal retractions. The laryngeal spasm that occurs with the tracheoesophageal fistula resolves quickly when the secretions are removed from the oropharyngeal area. In case of tracheoesophageal fistula, there is an overflow of secretion into the larynx, which leads to laryngospasm. And this can lead to obstruction. This leads to breathing problems. So they are using accessory muscles for breathing, especially diaphragmatic breathing. And so this causes substernal retraction. So this time we have to give suctioning. So the laryngeal spasm will relieve quickly. Okay, or resolve quickly when the secretions are removed from the oropharyngeal area. And the next question, which of the following vitamins functions like a steroid hormone? Options: option A vitamin A, option B vitamin B1, option C vitamin C, option D vitamin D. Question is, among this, which vitamins act or function like a steroid hormone? And its correct answer is option D, vitamin D. Today we discuss some of the important questions for exam preparation. Surely these questions helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle.